Hi everyone. I just wanted to say hi, and I know it's been a while since I've done any work, but I do appreciate everybody's coming to learn whatever I have to offer. This is session 65, which is the topic is to stroke or not to stroke. And the reason I say this because one of my family members recently had a stroke, and the symptoms were very, very difficult to diagnose because everything that happened was anything but typical of what happened when a person has a stroke. He went on for a long time being very vague. He was left-handed, of course, and the doctor could not make sense of the whole thing. The neurologist, nobody could figure it out. Everything was so vague. His symptoms was occasionally forgetful and just seemingly doing things the right way, but not enough to make it look difficult. We all know that strokes fall into two categories. They're either formed by clots or it might be bleeding into the brain. He had small bleeds, TIAs, in places like the basal ganglia. And like I said, what made it so difficult was because everything didn't happen in the typical way. He had a CAT scan done, and the CAT scan showed absolutely nothing. He had mild hypertension. His blood pressure rose up into the 170s. And during that time, it was considered to be a hypertensive crisis. And then finally, he had an MRI done, and they found small bleeds in different areas of the brain. Because everything was very difficult for the family, and the reason I especially want to talk to you today about one of the topics I'm going to emphasize is something called caregiving, which I think is overlooked. I think caregiving, as I was a student nurse, I went to school in London, England, and as students, this has been a while ago, we used to be the workforce. One of the things that I found about caregiving was I did a lot of my learning while I was a caregiver. We were student nurses and we worked long hours in the clinical setting, but at the time I did not appreciate what I had. But now I do, because now I look back, I learned so much. It was almost like not thinking that I was robbing myself of learning. I see caregiving now like a pot of gold. It is really special, and I know that I have several caregivers helping out with my family member, and some people, many of them tell me that they feel like they're treated like they're not even of any worth, and it's a shame really, because it is a very, very special thing. It is a very special job, interacting with that person, making them feel, like a human being. Sometimes they're treated almost like they're vegetables. People look at them and feel like, so what? They don't understand what's going on. Of course they do. A lot of them are very sensitive to what's going on. In fact, during the time that this family member of ours was sick, we learned a lot. He got very depressed, had a very difficult time in one of those skilled care facilities, so we brought him home. And now we have caregivers in the home taking care of him. And actually, there is just so much to learn. Day by day, he makes progress. Since he's been at home, he's not as depressed. He seems to interact with people better. When he was in that skilled care facility, he seemed to be left, from my own observation and my family members too, left for long hours, just sitting in a chair doing nothing, just wasting away. Now that we brought him home, many things that were not healing started to heal. He eats and drinks like normal again. Even though they wanted to put a feeding tube down, there was no need for it. He's back drinking and eating again. He's shown marvelous improvement. And so sometimes I think that I don't want to be the judge of anybody, but I believe that sitting in a chair doing nothing it doesn't do anything for you morally. And what are some of the things that I have noticed? Like I said, that I've noticed that at the time it didn't seem that way. These people stroke patients, they get really depressed, and that was overlooked. Just sitting in a chair, people think that they don't observe, they know everything. Now that our family member is starting to speak again, he can tell us how he feels, and it's sometimes surprising when he speaks, because people look at him and think, oh, maybe I should just make him, blink one, blink two. No, he speaks. He knows what's going on around him. And so it's important for us to look upon these people as human beings with feelings. They're not objects. They're human beings. They feel pain just like everybody else. They hear things. It affects their mood when they hear people saying ugly things about them. Sometimes people stand over them and talk like they're not even human. And all they're concerned about is it's unfortunate that caregiving has been so undermined in my estimation that I've seen people tell me that they work, in an office during the week and they just do this to make a quick buck. This is a horrible way to look at it. These are human lives, and I think one ought to be very sensitive to see what these people are going through. And one of the things that I notice also, that family involvement is also very important, that, things like music and stuff did help them. And participation from the family is also very important, not just looking upon, oh, I've got a caregiver, I can run off to the mall now. No. It's very important for the family to interact and make that person feel special. I know it's difficult. Sometimes it's really difficult, forgetting that that person, is aware of what's going on, but they are fully aware. It's been a tremendous, if I can find the words to describe the difference between having a loved one in a facility and having them at home. There's just been so much growth and so much, what a difference. The response to the environment and everything has been totally different. So I don't want to go on. It's just been an overwhelming experience for me, and I hope that you've learned something from this. So we've come up to Thanksgiving now, and please enjoy your Thanksgiving. Have a wonderful Thanksgiving, nurses. Pay attention. Don't overwork yourselves. Have a wonderful holiday, and the Christmas is coming up soon too. I probably won't have time to make a video. Have a wonderful everything, and stay posted for more clinical issues. Bye.